Hi, my name's Tim Pawlik from The Ohio State University, and I wanted to talk to you a little bit today about our paper, New-Onset Geriatric Syndrome, among patients undergoing major surgery and the impact on clinical outcomes and quality of life. As you know, over the last few decades, the proportion of older Americans has been steadily increasing in the United States, driving an important demographic shift. In turn, there's a growing population of older adults who are undergoing a major surgical procedure. Age-related declines in physiologic and functional capacity can contribute to worse perioperative outcomes. In the current study, we sought to assess the impact of postoperative geriatric syndrome on days at home after discharge, mortality, and complications. To do this, we identified Medicare beneficiaries who underwent a major surgical procedure, including CABG, AAA repair, pneumonectomy, pancreatectomy, and colectomy. New-onset geriatric syndrome was defined as a new diagnosis of delirium, fall, fractures, pressure ulcers, failure to thrive, dehydration, incontinence, depression, or malnutrition during the index hospitalization. The primary outcomes were days at home after discharge and 1 year overall survival. Among the more than 780,000 patients included in the study, roughly 1 in 10 developed new-onset geriatric syndrome. Key independent predictors of geriatric syndrome included older age, a higher Charlson comorbidity index, emergency procedure, and a pancreatectomy. New-onset geriatric syndrome was associated with markedly higher hazards of 30-day complications, prolonged hospitalization, as well as non-home discharge. In addition, patients with geriatric syndrome had significantly fewer days at home within the 90 days after their discharge compared to patients who did not experience a geriatric syndrome. In fact, patients who experienced geriatric syndrome as well as a complication had roughly half as many days at home than those patients who did not experience either one of those events during their hospitalization. In addition, new-onset geriatric syndrome was associated with a twofold increased risk of death at 1 year. Overall, our study demonstrated that geriatric syndromes reflect the accumulated effects of inpatient comorbidities that commonly occur in older adults. Development of geriatric syndromes after major surgery was associated with adverse short and long-term outcomes, and these findings highlight the need for proactive perioperative strategies to identify and address geriatric vulnerability amongst older patients who are undergoing a surgical procedure.